Hello, my name's Caitlin Waddle, and I'm a nutritionist at Children's Healthcare of Atlanta Multidisciplinary Feeding Program at the Center for Advanced Pediatrics and Marcus Autism Center. Today, I'm going to talk to you about overnight tube feeding and its impact on daytime oral intake in children with feeding difficulties. The use of enteral nutrition by means of NG tube or G tube are both effective solutions for ensuring children with feeding difficulty are receiving adequate nutrition for growth and development. While effective, prolonged use of enteral nutrition may delay development of oral feeding skills and lead to difficulty transitioning to oral feeds. Often parents are encouraged to feed their child orally, but they're unsure how to adjust the enteral feeding schedule to optimize provision of oral intake. If parents are not provided with guidance on adjusting the child's feeding schedule, it may lead to lack of progress with oral feeding. Stimulation of appetite is a critical component of increasing oral intake and weaning tube feeding. Intermittent bolus feeding is often recommended for appetite stimulation, as it is thought to be more physiological and preserve hunger and satiety cycles. Imagine if you snacked on a pizza all night long, maybe some soda too. If you are receiving 100% of your calorie needs overnight, it is likely that your appetite during the day would be poor. In children that struggle with appetite regulation and recognizing hunger cues, overnight feeds will likely not help to improve appetite regulation. Overnight feeding can definitely be easier for families in comparison to a daytime bolus feeding schedule. It is important to talk to parents about the pros and cons of moving to a daytime feeding schedule. Pros include encouraging a regular eating pattern and appetite regulation, both of which can help promote oral intake. Additionally, bolus feeding can help assess volume tolerance, meaning if a child is able to take 90 to 120 mLs in bolus feeds, they are likely able to tolerate that same volume of food. Cons of a bolus feeding schedule could include a temporary increase in vomiting while the child is getting used to a new feeding schedule, and it is a little bit more labor intensive for parents in comparison to hooking the child up to a feeding pump overnight. You can start the transition to daytime bolus feeds by working with the parent to understand their daily schedule. Break the bolus feeds up into 5 to 6 meals per day. Start with 5 to 10 mLs of formula or blenderized feed and advance by 5 to 10 mLs every 3 days until the terminal goal volume is met and the overnight feed is discontinued. Work with the parent to see what they're comfortable with. If the parent is nervous about the transition, 5 mLs may be the best way to start. If the parent feels confident and there's a low risk for vomiting, 10 mLs may be the best place to start. If vomiting occurs, go back to the previously tolerated volume and hold until an appointment with the GI physician or dietitian. Thank you, and please feel free to reach out with any questions.